Is it my jaw or is it a headache? Hi all, I'm Liam from Melbourne Headache Solutions, and lately I've been seeing lots of clients complaining of jaw pain, which is either coinciding with or causing their headaches. So I thought I'd give you some info on what the cause of this may be and why. So if you're suffering from TMD or headaches, stick around to watch this and you might just get some info to help. So firstly, without getting too anatomical, I just want people to have a brief understanding that the jaw is very closely related to the neck, in particularly the upper three joints of the neck, which most of us already know are the joints that are involved in the majority of primary headache disorders, like tension headache and migraine. They're closely related due to their bony proximity to one another, due to the muscles that attach coming from the neck up to the skull and the muscles that attach from the skull to the jaw. There's also a nerve called the trigeminal nerve, which I'll talk about soon. Okay, so that leads us to the question, is it my jaw and the structures of the TMJ causing my head pain, or is it a headache that I'm experiencing? Now, without a thorough medical exam, it's really impossible to say. Quite often it can be a combination of both conditions coinciding with each other, and the reason for this is because the trigeminal nerve is responsible for the sensations we feel in our jaw and our face, and it's also responsible for the way that we use the muscles in our jaw. When a patient suffers from true TMD, the pain receptors in their jaw will send signals to their brainstem, which over time can cause a condition called central sensitization, which is a condition involved in chronic pain conditions like headache and migraine. In addition to this, chronic dysfunction from the neck can over time cause the trigeminal nerve to become sensitized, which then refers pain into the jaw and the temporal region. So this makes it very important that when we're treating headache and facial pain, that a thorough medical exam be carried out in the first place, so that if both conditions are coinciding, they're treated at the same time to give the patients the best chances of recovery the fastest. However, not all patients are experiencing both conditions at the same time. A lot of patients with jaw pain are only experiencing true TMD, and this can be because of things like inflammation, or it could be results of muscle strains or over clenching through the jaw, and it can be even toothaches from, say, wisdom teeth or something like that. On the other hand, it could be purely referral pain from the neck because of dysfunctions in the neck, and there could be no real damage to the jaw. These patients, they're often getting pain referred to their jaw because of sensitization of that trigeminal nerve, which we spoke a little bit about earlier. This is a very typical presentation for those that suffer headaches and migraines, because a lot of these patients will experience pain through here and through here when they have an episode. I guess the bottom line here is to get a thorough medical exam if you are experiencing head or neck pain, or headache pain, and then once you've had a thorough exam, then you can design a treatment plan that will treat both conditions or whichever condition it is properly. Okay, so I hope this helps, and if you've ever had jaw pain or head pain, and you don't know whether it's your jaw or your head or a combination of both, then drop a comment below and ask, and we might be able to help. Thanks.